Welcome back as we continue our focus on education. Right now, I want to let you know about something new for those students that are involved in speech therapy. TikTalk is now in the digital realm. This is taking speech therapy to everyone in a way that has never been done before. Very useful for speech pathologists, children, and their parents. Here to tell us more is Nir Gamliel. Thank you so much for joining us today virtually.
Thank you for hosting me. Pleasure meeting you.
So Nir, I'm so looking forward to hearing about this. Tell me more about TikTalk.
Okay, so maybe I'll start from the beginning. So the company was established back in 2015 and actually back in Israel, and actually started its operation in 2019 when we started working in the US market only in mid-2020, in the middle actually of the pandemic. The idea of the company was based on AI and speech recognition expertise, which the founders has, to start a product which with the mission to develop educational tool to help speech language pathologists, SLPs, as you mentioned before, and their patient, but to create a tool which will help them work together without any limitation of time and place. So actually both the SLP and their patients, the kids in this case, will be able to practice and to work together when they are face-to-face in the school, or also when they are working remotely, when the kids is at home, the SLP is at her clinic or office. So to have no boundaries in terms of treatment. So something which is not exist today. They are doing today certain level of teletherapy, but not in this level that we are presenting here. So the company was established as I mentioned, and we came out to the market with a product called TikTalk. So TikTalk is actually it's a tool which is working based on two components. One component is the Slp Portal, where the SLP is sitting on her or his computer, working on the portal and setting up the goals and the protocol for the kids or the patient to practice. Individualized protocol, very specific to the need of the patient, to the need of the kid in this case. And on the other end, the other side of this system is the tablet which the kid or the patient is using. It can work on any tablet, either iPad or Android tablet. And what you see here in the background is as the SLP is setting up the goals for the kids. So it's very easy. It takes just a few seconds, and those goals are very specific for the kid and for the therapy which the specific kid need. Once the SLP set up those goals and hit update, setting up the words, the sentences, the phrases, everything, either articulation or phonological processing goals, she's hitting set the goals, and then everything via the cloud is downloaded to the tablet of the kids. All is left for the kids to do wherever they are, even if they are in the clinic, walking with the SLP, in school, at home, wherever they are. All they need to do is open their tablet, open their user, and start playing games. While they start playing games, they will hit a certain stop in the game when they will be requested to repeat or to practice their words or the protocol which the SLP set for them just a few seconds earlier. So they can do it either when they are in the clinic or when they are away, synchronous or asynchronous. And so this is giving everyone the flexibility to work without any limitation. As we all know, if I would like to talk a little bit about the market, this is a huge market. And we have only here in the US about 5 million kids between the ages 4 and 12 or 13 who are suffering for speech and language issues. And we have only 85,000 SLPs who are attending to work with these kids, who are specialized and dedicated to work with these kids. It's a lot of work, and many of the SLPs and many of the kids are not getting the right treatment which they supposed to be getting. Using this system, we hope to get to many more kids in a much more accurate way. Another feature which is important to mention is the correctional feedback. All this system is based on AI and machine learning, artificial intelligence and machine learning, which is the system is all the time listening to the kids, listening to the words which the kids is saying. And as the SLP taking a decision, the system can also correct the kids and give them the right feedback at the right time, at the right place. So if the SLP decide, even remotely, when she or he are not next to the kid, to the patient, the system can still correct the kids, correct the mistake of the kids and help them practice and get better treatment again at any time and place. So we hope this way to get to many more kids in a much more accurate and better way.
You're utilizing AI to create a very personalized experience for these kids so that they can get what they need individually, because it's all a very individualized approach depending on what they need to work on. I'm curious, for the speech language pathologists, are there some challenges in them utilizing this program? Is it time consuming? Is it pretty user friendly and pretty simple to incorporate within what they're already doing?
Yeah, so this is a very, very good point. I think what we try to do with this system is to create a system which is self-explanatory and very, very easy and user-friendly, very easy to use. So when they can learn this system without any issues with the minutes. We are offering special program of about 1 hour, 1 to 1.5 hours of training program or demo, when we are showing the SLPs how to set up the program or the protocol for the kids. And from this point on, the SLP can work and prepare the protocol for the kids without any problem or issues. And they can set as many kids, as many patients as they have on their caseload. What you see here now on the screen is actually the patient side. You see here, the kid is actually playing game. In this game, it's a soccer game. And then they are hitting a certain stop. At this stop, they are requested to repeat a word or a sentence or phrase, and the system is being able to correct them. And this small dragon is coming in, can correct them or give them an encouragement feedback. So in general, the system is very, very easy to use without any problem, but we are here to help if they need to. And it's also very easy for the patient. But what we are trying to create here a tool for the SLP. So the patient cannot just download this. They can download the system from the App Store, but they need an SLP on the other end to activate this app to be working according to the protocol which is preset for them.
As a parent who had a child with severe speech delay, who was in speech therapy from pre-K all the way up to 8th grade, this is really potentially a very positive development, a bit of a game changer when you think about all the different things that you've mentioned, but also in that it will help parents practice at home, which is a huge piece of the process in helping kids who have this speech delay or speech issues, is being able to practice these things at home and having this way to do it with personalized approach and the pronunciation and the app and making it a little more fun for kids really seems like a positive development. Where can we get more information?
Yeah, so you can get much more information on our website at TikTalk.care and learn more about the system, and also ask your SLP to engage with us and to start working with us. So everything is on our website, and again, TikTalk.care. But as you mentioned, I think one thing which is important to say, what we are trying to make a very easy solution for the SLP and the kid, but you also mentioned the parents, which is very, very important point. Right now, big part of the practice which the kid's supposed to do, they're supposed to do it with their parents. The SLP is giving the parents the practice to work with the kids and to, in a way, to sit on the kids and to convince them to work and to practice. There is lots of burden also on the parents, and for the kids, they don't like to practice. Show me one kid who would like to sit and repeat their words and so on, and they just want to play, they just want to have fun. So what we are trying to do here, we are trying to give them games and to let them play the way that they want. We let them do what they want to do, but in the middle of those games, they are hitting those stops. They need to repeat certain words, and then the system will correct them. But also remember that we can utilize that to let the SLP to work directly either in the clinic or remotely or via teletherapy with the kids. Everything is possible, and this is what is nice about the system, which the system is giving the SLP the flexibility, and hopefully the kids are practicing in a much more fun and exciting way.
Well, thank you so much, Nir, for joining us today from TikTalk. Fascinating technological development to help speech language pathologists, parents, and kids as they progress through speech therapy. If you want more information, you can find out more at TikTalk.care. We'll be back on Mountain Connections right after this.